Good afternoon, and thank you all for being here. My name is Dr. Patrick O'Shea, and I am president of the Newfoundland and Labrador Medical Association. I'm also a family physician in St. John's. Speaking as the NLMA president and as a family physician, I can say unequivocally that the loss of even one of the physicians who resigned this past Friday is devastating to the healthcare system and to my patients. To lose 14 of these highly trained, experienced specialists is a blow that the Newfoundland and Labrador healthcare system may not recover from. There is no question that these resignations will further destabilize an already fragile system. I have met with many of the physicians who have resigned. I know the personal toll the decision to leave their practices has had on them. These were not easy decisions. They have my personal support, and they have the full and unqualified support of the NLMA. Representatives of the group have already eloquently stated why they felt they had no other option but to tender their resignations. As Dr. Julia Trahi said on Friday, the time had come for them to stop fighting to stay and to begin preparations to leave. I know how hard they have fought to stay. Over the past 2 years, since the Premier instituted a separate pay scale for oncologists and pathologists, their salaried colleagues have met with government to make the case for fairness. The principle of equal pay for work of equal value is one we can all understand. All salaried specialists are highly trained and care for patient groups that are equally important. There is no justification for paying one group of specialists twice as much as the other, and in fact, doing so has damaged recruitment and retention efforts. We know that being competitive is the only way we can hope to stabilize the physician workforce in this province. That has been the underlying goal of our negotiations with government to date. Unfortunately, government has refused to address the inequities it created in the salary physician pay scale, and we are paying a heavy price as a result. The resignations are not a ploy. They are not an attempt to get a side deal. They are the outcome of 2 years of closed doors, of repeatedly being rebuffed by a government that does not value the work they do and the care they provide. This lack of respect was evident on Friday in government's response to the resignations. Health Minister Jerome Kennedy's cavalier statement that the province will be initiating recruitment to fill the 14 vacancies is cold comfort to patients. We have had unfilled vacancies for many years despite recruitment efforts. Specialty areas such as general internal medicine, pediatric ICU, neurology, and medical genetics have been chronically understaffed. The increase to pathology and oncology 2 years ago has demonstrated that competitive compensation helps solve physician shortages. Both services have a full complement of required physicians. One of the resigned physicians, Dr. Mark Stefanelli, is a neurologist who has devoted a large part of his practice to the care of patients with multiple sclerosis. His resignation leaves the province without a physician leader for the province's Liberation Therapy clinical trial and places the future of this trial in jeopardy. Another of the resigned physicians, Dr. Debbie Reed, is a pediatric intensivist at the Janeway. Her resignation means that the pediatric ICU will be down to 1 full-time intensivist as of February 4th, 2011, where at least 3 were required. This is an untenable situation. The pediatric ICU treats the sickest and most vulnerable patients. Without an adequately staffed ICU, these children will have to be sent out of province for care. Is this acceptable to government? Is this what constitutes good health care management for the children of Newfoundland and Labrador? It was troubling on Friday to hear the Minister of Health dismiss the notion that these physicians do not work hard enough. He also questioned if they were equally trained and equally skilled. This lack of respect for physicians is symptomatic of the challenges we have faced during the protracted and frustrating negotiations with government. Since the resignations became public, I have heard from many of my colleagues, and we have heard from our patients. We are all concerned about what this will mean for the future. Certainly, it will mean recruitment and retention will be even more difficult. It will mean longer wait times for our patients. It will mean further instability in the system. And now I'm happy to take your questions.
Dr. O'Shea, typically when something like this happens, where we do see ultimatums going back and forth from both sides, heads cool down a little bit after that. Have you seen any movement since the events of Friday and the lines that were drawn that would lead you to believe there can be any kind of a resolution to these specialists resigning?
We haven't seen any movement whatsoever. And again, one of the frustrations is that since April, there has been very little movement whatsoever with government. And that's one of the big frustrations. There's been no movement. They haven't offered any more money, anything else. So that's the frustration we've been having.